with which we are living into solidarity. How do you do that? A lot of attention is being given today to the need for transnational or global governance structures, although we don't have much consensus about what those structures would look like or how they would gain their authority. Drawing on the interconnection of human rights, global public health, and biotechnology, some are arguing for the formation of an international supervisory agency, perhaps one out of UNESCO, that would oversee research and development in genomics. Such an agency would give regulatory power to documents such as the 1997 Universal Declaration on the Human Genome and Human Rights. Given the central place of human rights in the Catholic social tradition, it seems to me that one way to take up the option for the poor is to join efforts to develop some kind of workable vehicle for transnational solidarity around public health initiatives. However, that being said, in a recent article in the Journal of Religious Ethics, Lisa Cahill argues that the most important role for religious action on behalf of the poor today may well lie outside of the arenas of law and regulation in cooperation through global advocacy networks. Religion can and should be a powerful force for education, for joining parties in opposition to inequities and violations of human rights, and for consolidating an alternate vision in the face of the all-encompassing power of the market. As an example of this potential, Cahill points to international grassroots organizing in opposition to the imposition of genetically modified foods on developing countries. It was an effort that joined religious groups, non-governmental organizations, Episcopal conferences, and then ultimately reached policymakers. We could also point, as an example of this kind of grassroots organizing, again, to the Rollback Malaria Partnership. That is a grassroots partnership, which also involves public and private collaboration between interests in Europe, China, and the US. And it's aimed toward ramping up, among other things, ramping up production of anti-malarial drugs. Another example of this kind of grassroots organizing would be in the kind of public outrage which ultimately led to a change in pricing of AIDS drugs. I began this afternoon by talking about the sense in which we live, in healthcare anyway, in a revolutionary age. In an age in which we are opening up new frontiers in the pursuit of health, and in an age in which we are redrawing the boundaries. We see this in a very dramatic way in terms of the Human Genome Project. We also see the way in which new biotechnologies risk widening old and scandalous gaps as many developing nations see themselves falling on the lean side of the genetics divide, and as new risks of genetic inequality join old realities of differential access to healthcare here in our own country. I think in some ways the Holy Grail is a very interesting image because it is, after all, a blessing cup, right? And a blessing cup is, in our tradition, a cup meant for all. But the best image that I have come across, actually, to capture the moral challenge of this age, the age of gene mapping, was used by the philosopher Albert Johnson. He likens this age to the beginning of the colonial period. He wrote, "The ships that sailed from Europe 5 centuries ago not only mapped the world, they inaugurated social, political, and economic events that radically changed humankind's view of itself and nations' views of their destinies. The rapidly redrawn map of discovery and colonization depicted areas of glorious achievement and areas of deplorable tragedy." Whether the map that we are making in understanding the genetic basis for life will chart spheres ultimately of achievement or of tragedy, of health for some or health for all, depends on the commitments that we're willing to make on the journey, the kinds of values that we bring to the enterprise, whether they are profit, utility, individual liberty, or respect for human dignity, solidarity, concern for the common good. How we will look back on the changes we have ushered in will depend on what sort of regard we have for what we encountered, what interests come into play, who wants the technologies, who profits from them, and who bears the burdens, how they are regulated, and ultimately whether we are willing to take the part of the poor against the voices that would drown them out. To borrow from yet another philosopher, it will ultimately depend on whether we of the 10% world are willing to continually remind ourselves what is wrong about a world in which some of us live well into our 80s and 90s, and if the promise is correct, some of us will live well into the hundreds, while others of us die before we had a chance to live, in which some of us go on diets and pay cosmetic surgeries, while others of us starve or beg for food, in which some of us have access to life-saving technologies, abundant pharmaceuticals, every manner and fashion of care available. So much so that we have to decide when to say no. While others of us drink contaminated water, breathe foul air, and lack the simplest of immunizations. Thanks. Yeah.
So please direct your questions to Dr. Ryan, and if she's missing your hand, I'll try to look for it. Teresa?
Teresa?
I just have a question. Are you aware of any Catholic universities that would be supporting scientific research along the lines of the values that you've been talking about in the outcome for the poor? And the second part is, our scientists here, it's capital-intensive research, and our scientists here seem to rely on grants from the NIH and NSF, and I'm wondering if they are funding that type of research.
Well, I know the most about my own university, and again, I can say that we have a mix, and I would imagine that we're probably pretty typical in that we have much of our genetic research is oriented toward cancer, we've also got quite a bit going on right now in the biotechnology in the areas of things like rehabilitative medicine. But we do have, and here it's related specifically to Holy Cross's mission history. We do have a set of research sites in Africa and in Haiti. They both built on Holy Cross mission involvements that were already there. But they're aimed at, the one in particular in Haiti, is aimed at again, at developing technology that would, vector technology, that would lead eventually to a malaria-resistant mosquito. And I see that research, and it is funded. I mean, that's funded in part by NIH, I think, and some of the new malaria funding that's most recently come out. It come out because, again, of the sort of outcry, public outcry about funding. So there are new opportunities for malaria funding, but the reason why that's been a commitment, even in an underfunded area, is because Holy Cross has traditionally had relationships with those countries.